Hi everyone. Welcome to the COVID-19 Virtual Information Session. Glad to be with you today. My name is Pam Yankeelove, and I'm the Director of Research at the Traeger Institute. And Dr. Anna Fall and Dr. Christian Furman are unable to be with us today. They have other commitments. So we will continue on and in their absence. Let's see. So we're going to ask that you go on and keep your microphones muted during our session, just to keep the noise and background noise down. So let's go on. And next slide, please. Yes, hi. So what we always try to do is we go through our best practices to make sure our session is the best we can be, including making sure that all of our mics are muted. Then what we want to do is we want to type our questions in the chat. What we do is we have a medical presentation from Dr. Laura Morton, and then we'll have our guest speaker, and then we'll ask you that you go on and put your questions in the chat, and we'll go on and read those questions off. Please use respectful language, and if you're concerned about your health, you can call 588-4340 or call the Kentucky COVID hotline at 1-800-722-5727. If you're having any difficulty with your Zoom, there are some ways to make sure that you can check your technology. You can go in the lower left-hand of your screen, lower left-hand portion of your screen, if you're having difficulty with the sound. And you can click on the arrow next to the microphone to just go in and test your system. And there's also ways to go on and call in if you can't get your computer to go on and work. So let's next time. Yeah, we do also ask that you go in and type your county into the chat. Chat's in the kind of the lower left-hand portion of your screen. Hopefully you can also find it on your phone. And this lets us know exactly our reach throughout the state of Kentucky. So it helps us get a sense of how many counties we're able to reach. So welcome again to the COVID-19 virtual session. We always begin with a medical update. We do have Dr. Laura Morton joining us, and she's a geriatrician at the Traeger Institute, and she can also introduce herself and share the update with us.
Thank you, Pam. Good morning, everybody. I'm so happy to be here again to give the COVID-19 update. As Pam said, I'm a geriatrician and division chief for geriatrics, and I work primarily in the post-acute long-term care setting. So some of you heard me speak about that in previous weeks. So the biggest update I believe that everyone should be aware of is the increase in number of cases. This is going on across the country, but in Kentucky we have had our highest day of cases so far, and it was on the 19th. So on Sunday it was 979 total cases with 9 deaths on that date. And I think that's important for everyone to be aware of. As of yesterday, Kentucky's had 671 total deaths over the course due to COVID. The governor implemented a mask mandate about a week ago for all public places. And again, it's really important for everyone to remember that it's better to do things outside. If you can't socially distance even outside, to wear a mask and try to minimize your exposure and limit the number of contacts that you do during a day. So if you're going to go to the salon and maybe the grocery store, maybe you do those over several days as opposed to doing them at once. So it's important to remember that. The other thing to think about is that the positivity rate has gone up, which means that more of the testing that's being done is actually coming back positive. So the positivity rate's up to 4.52. So that's another concerning factor. So all the health officials are watching this very closely, and hopefully everyone will be able to wear their mask. Please wear your mask, and that we can slow the spread. The other thing that the governor announced yesterday is that social gatherings are a maximum of 10 people. So that is new, so scaling back a little bit. He also put some travel recommendations for what I think they described as really hot states, and Arizona, Florida, and there's a list of about, I think, 10 states where if you travel to those, the recommendation is for you to quarantine for 14 days. And the other thing is just a reminder, Governor Beshear is now doing daily updates at 4 p.m. every day, Monday through Friday. So please be aware and look and wear your mask. Thank you all.
No, thank you so much, Laura. Yeah, so I think the message was wear your masks. All right, thank you so much. All right, now what we're doing was going to turn towards our guest that we're so excited to have. All right, so we have Dr. Lihui Bai, who is an associate professor and director of graduate programs of industrial engineering at the University of Louisville Speed School. She is also the co-director of Logistics and Distribution Institute. Dr. Bai's research interests include operations research, optimization models and algorithm development, transportation and logistics and supply chain management, energy systems, and healthcare logistics. Her recent works have been funded by DHS, GE Appliances, FHWA through the Kentucky Transportation Cabinet, and the National Science Foundation. Her title today for her session is Logistics and Healthcare Delivery in Combating the COVID-19 Pandemic. So welcome, Dr. Bai. Let's see, if you have your microphone on, you are welcome to begin when you're ready.
Sure. Good morning, everyone. Can you hear me?
Yes.
Okay. Thank you, Pamela. And I know Anna is not here, but thank you so much for the opportunity for me to talk about how logistics, which is a very engineering discipline, can be helpful, in healthcare and in particular for COVID-19. Together as a community, any help would not hurt. So I'd like to, again, thank you everyone for tuning in for today's, webinar. Mainly when Anna approached me, I told Anna that, we don't do a lot of the frontline, medical treatment, those type of work. What we do is to help the logistics and help hopefully the medical, the healthcare delivery to be a little bit more efficient and more smoothly. And also to meet the, patient's satisfaction a little bit better. So that's what we do kind of behind the scenes. A lot of our work, because we're in industrial engineering, so it sort of gave a mathematical description about the system. And then those descriptions tend to be able to be computerized so that we can use modern computer software to get the solution and hopefully shed some light to the practitioners and then to other staff members that's in the healthcare system. So that's in general the theme of 3 examples that I like to discuss. I know the format for this session is, we're trying to have a, very live dialogue. So I'm gonna sort of talk about 3 different examples and projects in about 20 to 25 minutes. And then after that, I'll open up for questions and then, so we'll see how that goes. So again, COVID-19 kind of hit us right in March. And then after that, we were in a spring break. And then we were contacted by various organizations. Dr. Carrico from, UofL Department of Infectious Disease, she is the first one who approached us. So wanted to know how to calculate the maximum capacity of their testing, lab so that they can have the maximum throughput. So that's the very first one. And then we sort of did some calculations for them. I also want to mention that a lot of work is a joint work with the colleagues in industrial engineering, as well as LoDI, and Dr. Monica Gentili is the other co-director. She cannot be here. So that's the first contact that we have, kind of provide some analytical assistance to COVID-19 combat. So helping with the lab testing, estimate what is the maximum capacity, how those machines should be run so that the maximum capacity can be reached. But specifically, I want to talk about the first project. I'd like to start with the first project. That is the project that's ongoing with Trigger Institute. So this was proposed during a meeting with Pam and then with Anna. about, when the Trager Institute is ready to fully to reopen, let's say in August. So what is the maximum capacity for this institute so that we can all deliver, healthcare very safely, not only to the staff, not only to the patients, but also to the staff. And then one unique thing about the Trager Institute, the way I see it, it's a multi-resource clinic. So it not only has your regular primary care physicians, those type of service, but also has the psychotherapy, has the wellness, and also has a lot of what they call the mosaic service, right? So a lot of them probably due to the COVID-19 has been moved online. So this is a multi-resource type of clinic. So therefore, when we talk about capacity or what is the high density area and when that high traffic would occur would become important, especially during the COVID-19 when certain social distancing has to be in place. So therefore, myself and Dr. Monica Gentili, and then Dr. Arsalan Palashi and another graduate students, we work with Anna and her team to trying to develop a simulation model. We call it a simulation model, basically to simulate the patient's flow in the clinic from the time when the patient check in, and then with the receptionist at the front desk, and then they will be, after the medical assistance become available to that particular patient. So they would be interacting with the MAs, and then after that, they will wait for the doctor to come in the room to visit, and then all the way until they leave the clinic. So we would create a simulation model for every day of the week, also for the morning and afternoon sessions, so that we're able to track the movement of the patients in the simulation model. Also, we would be able to track the MAs, medical assistants, and then doctors when they're switching between patients. Another thing that we're like, because of the multi-resource nature of this clinic, we also like to incorporate the students' navigator, their movement across 2 different floors, and then the researchers, mainly they're in the main level, but they also would, for example, hallways will be shared. So what time of the day, for example, on Monday, would be the most higher traffic during, in that hallway area or in the initial reception area. So those are the things that ultimately we designed this simulation model to be able to capture and then tally the statistics as the time goes on during the day, as well as multiple days. I mean, some days, for example, I know for Trager Institute, Monday and Wednesday are very busy. So especially on those days, what time during the day we see the highest traffic, and then those traffic last for how long. So using the technology, the technique so-called agent-based modeling, we're able to forecast or estimate such kind of high traffic time and location. So when we give this information back to Trager Institute, I think their administrative team will be able to come up with some kind of a mitigation strategies to trying to either lower the traffic or kind of shift their work schedule a little bit so that that traffic can be leveled, can be lowered and also be leveled. And then if they do have a specific strategy that they'd like to try out, one thing is without going live directly, we can again going back, plug that new strategy, somehow quantify them in our model, simulation model, and then be able to run and say, what if we have this strategy in place, how the situation can be alleviated. So that's the idea for such kind of simulation model. So we call it a patient flow simulation model. Yeah. So that is one example of what industrial engineering or what mathematical modeling and simulation modeling can help in, in this case is to estimate the capacity of the clinic. It's not necessary, I mean, but also I think as the byproduct, we can also see the throughput of the system. We can also, estimate what is the utilization of the system, see if the, the efficiency, we can also help to assess the efficiency. So with such a simulation model. Any questions on this project? No?
Let's see.
No question.
Not yet, but I have a feeling there might be some questions later on. I think people, as Dr. Bai is going through her presentation, you might want to think about the, application to your organization or your agency or your institution, because we've been blown away about thinking through how to actually accomplish this, social distancing of 6 feet and how to keep everyone, how to keep the clinic going, how to keep the institute going, but still trying to make sure that everyone is as safe as possible. So it's been an interesting process working with you and your team to kind of figure this out. So I think as people begin to think through, we just went back to work without really thinking through, or we had enough space, or we didn't have enough space and we're still at home. I bet we'll start having some questions. So yeah.
Another thing, for example, this is sort of a give, people some kind of ideas thinking along. The data source that this simulation model would use from any clinic, for example, would be the floor map, the blueprint of your floor map, if you have multiple floors. So those will be directly imported to the simulation model. And also, we take all of the, after you sanitize your patient's name and everything, so we just need patient number 1, 2, 3, 4. So their appointment schedule. So in other words, your appointment schedule book. So this would allow us to know the frequency, how frequent your patient coming in, and then what we call the interarrival time. So the time between successive arrivals of patients. And also we would talk to Pam and Dr. Furman and all the doctors, making sure that we understand good enough about how much time the patient spends with, for example, with the receptionist in that area, or how much time they spend with the doctors, whether it's 15 minutes or 20 minutes and so forth. So those are what we call the service time. So that would help us to mathematically, estimate how long the queue would be. How long are you supposed to wait? And then especially in the high traffic area, how many people, at any given time would be there. So those type of information. So those are the basic data that we would need in order to develop such a model.
Yeah. So. I was also thinking, is Laura still with us? Because I was thinking, as the nursing homes start to open up, I think on July 15th, they started to open up to visitors. I wonder if there's been any, thought behind how many visitors can show up at a particular time, or the movement of the visitors. Is Laura still with us? Because I know that she's on a task force and she has access to information. I wonder if there was that kind of conversation. Here she is.
Hey there, I was trying to flip back over. Can you all hear me?
Yes.
Yeah, so it's really interesting to think about that. The way the guidance has come out from the task force for visitation in the nursing facilities is that it's supposed to be socially distanced. And so most places are really limiting it because of just staffing and logistics, because it's very hard to put these visits somewhere where they can be monitored, to make sure that, to allow people to have the privacy, but to be able to try to enforce that social distancing. So they're not having a lot of people anyway. The guidance says people are allowed to have 2 visitors at a time, and it depends upon what the facility is able to do. It's really interesting to think about it, though, when I think about communal dining, and listening to what you have to say, because communal dining is a real issue because they're all trying to follow. So that's been allowed since about June 29th. trying to follow the guidelines for restaurants and things like that. So it's very interesting to think about if there was a study done in nursing facilities to try to think about in a more scientific manner about how to do this, because at this point it's a much more of I don't want to say guessing game, but it's much more trying to follow the guidance as best you can. And probably they're doing a little more spacing than maybe if we did it scientifically, we may have to do, but it's just trying to be more conservative. But that's a good question, Pam.
Yeah.
I think the conservative approach, if ultimately it boils down to, any given time and then two visitors allowed, it's probably easy for people to come up with a good guess. When the situation or the scale, what we usually call the problem scale, gets larger, that's when your human cognitive ability cannot handle those guesses anymore. So that's why the computer software, computer model would become very advantageous at that point.
Thank you.
Yeah, okay, so if no question on this one particular, or I can wait for more in, later, I'd like to also talk about the other project. This project is, you may have seen this in the news, that a group of UofL researchers, I think it's led by Dr. Leslie Sherwood and Steve Davison, I believe, from the clinical veterinarian of School of Medicine of UofL. So what they do is they take used N95 masks. So this is when in early April, when the PPE supplies is still very hard to get. So the creative solution was, why don't we recycle the N95 mask and then safely decontaminate them so that they can be reused actually for up to 20 times. So this particular technology, I believe it was developed by Duke University when the Ebola outbreaks occurred. And then the technology was approved by CDC. So Dr. Sherwood and Davison, so they kind of, utilize that technique to alleviate the pressure of, the shortage of PPE, especially a N95 mask, doing this, decontamination project. So again, we're doing kind of a behind the scenes work. They have one service truck that every day, the first time when we contacted them, I think there are 22 healthcare organizations, your clinic, throughout a town in Louisville. There are 22 healthcare organizations that sign up for this. This is a free program. I think they provide a free decontaminated N95 mask to these organizations, as well as the first responders, and then the public health, Metro Public Health. Given that there are many delivery points, if you consider like Amazon's, truck has to go out, or UPS truck go out to neighborhoods to make multiple deliveries, but they have a whole fleet of vehicles. But for this particular project, decontamination project, they have just one service truck. So what's the best way for this particular service truck to accomplish two things on a day? One is to collect all the contaminated N95 masks from various hospitals and so forth, and then bring them back to downtown UofL House campus where the decontamination process is being done. And the second task is, once you have daily cycle, when the decontaminated masks are available, how do you distribute them to those healthcare institutions? So in the beginning, when we were contacted, there were 22 sites, just this one vehicle. So this is a very traditional industrial engineering or logistics. We call this a vehicle routing problem. Basically, you're finding out what is the optimum route for a vehicle trying to visit multiple places in a town. So we helped them with some earlier master students. They did some case study from my course, but another PhD student, his name is Zebi. So he helped to develop a Microsoft spreadsheet-based tool so that people can just click buttons and then figure out the route. So in other words, for the director of this program would go in every morning and then populate the sites that the truck needs to visit. It may be 20, maybe 25. They can actually feel free to add more at their wish if those changes on a daily basis. Once they enter those sites, this particular program will use Bing Map online to calculate the distance between those, delivery points or collection points, and then gave the optimum route for this vehicle so that the vehicle can get the job done in the most efficient manner. Another factor that we had to consider is different organizations or different collection points or distribution points have a different demand. Some of them, the truck has a capacity of 18 bins. So basically they put those, decontaminated one in bins for each organization. So the organization has, this organization, may have this, let's say Baptist Urgent Care may just have 2 bins. I need 2 bins of decontaminated, and the other one may have 3. So the truck has a capacity of 18 bins. So on a busy day, it may require the truck to come back or for a second trip. So we're able to develop this automated routing system for this decontamination project so that every morning the project director can just click on the buttons and then be able to tell the driver turn by turn, this is going to be your first stop, you're going to travel, and then by driving another 6.5 miles, for example, you're going to go to the next one. So give you a turn by turn direction that overall would minimize the travel distance, therefore minimize the delivery time, minimize the cost, fuel cost. So that's a typical industrial engineering project applied in particular to help a little bit with the community in COVID-19 pandemic.
Yeah, I gather many of us have not really thought about the behind the scenes experiences that go along with getting, like N95 masks decontaminated, and probably never once thought about how here we have an institute at the university that's trying to figure out, the distribution of the decontaminated masks to all these different sites and how to do it with a reduction and, make sure it's so efficient and cost. I mean, I always love hearing about your projects because, it's so much behind the scenes that none of us really think about how these things happen. But here we have a group of industrial engineers that are making it happen. And
Yeah.
so that we can all benefit as patients and providers.
Thank you. Yeah.
Yeah. Yeah.
I don't know if the audience have any questions on this particular project.
Does anyone have any questions regarding? Not yet. Not yet.
But by the way, I think, the vehicle routing problem, can be equally applied to let's say a large healthcare campus. If you have to transport patients from, place to place. So this kind of routing problem can also help, to pick up patients from various spots at a large healthcare campus. So sort of an intra-hospital, or even intra-hospital transportation.
Mm-hmm. Yeah.
Also, Dr. Monica Gentili, I think she once worked on a project which helped to design the senior shuttle service. So the shuttle service would provide seniors to transportation to places like library, theater, and things like that. And then how to best design the route, and then also the time. In that particular case, I think the shuttle service, the timetable is also very important. It's not as important for the decontamination project, but for those kind of shuttle service, I think the timetable can also be determined.
Mm-hmm. Mm-hmm. I also wonder about right now, there's so many of us that are, trying to put on conferences, and we've gone from, our face-to-face to canceling our conferences, to trying to consider to do hybrid, to doing ones where, how can we make sure that we continue, on and making sure that we educate one another and benefit from one another, but how do we do it in a safe way? And I know that Barbara has been working on with a team of individuals about our optimal aging conference and trying to figure out what's the best way, even, we keep moving it, from a standpoint of first it was in April and then we moved it and then we moved it again. And now it's almost a year later that we're going to be having it. And we're still, conversing about whether it should be a hybrid conference or, where there would be individuals on site that are in the local area and how to keep them safe and as well as there'll be individuals virtually. And I just think about all of the different, movement of people, movement of items, movement of, that I would assume that, there's so many projects that your institute can actually take on. And can you tell us a little bit about how, if an individual is interested in bringing a project to you, what would that project, how would be, the approach to do that?
Yeah, there are multiple ways that we could take on project and collaborating with, other stakeholders. For example, right now, the one with Trigger Institute is we just work that for doctoral student to work as a side project. So when the semester kicks in, that becomes more difficult because the student has, 3 or 4 classes to take. So summertime is ideal. Also, we have a capstone project that a group of industrial engineering seniors would be working on the project with some mentoring and guidance from a mentor from the faculty. So that's another way. And also, we could engage a master student who, in order to graduate, always have to work a master project. So that's another way to do that. Those are sort of your low cost options, and then if you really want to invest for more faculty time directly involved in the project, we just work on some sort of a consulting type of project. And then once we understand what your need is, and then we will write up, this is going to be the scope of the project, and this is the deliverables, and then with a certain university budget costing, going into there.
All right, thank you. We do have a few comments. Laura Morton said that it was a good point that we talked about. We don't realize what's happening behind the scenes, and so appreciative that you're there to help. Barbara Gordon says, have you all studied or worked with the restaurant industry to help them know how to position seating to improve safe dining? Also, if there's any movement or any of the work that you or your colleagues have done as it relates to school, including elementary, middle, and high school. So restaurants and schools, have you had any or heard any across the nation that's going on?
Yes, very good question. I think for the restaurant, when you talk about seating, that's another area in the heart of industrial engineering, which we call the facility layout. So we would lay out a facility knowing how in the traditional industrial engineering, how the production line goes, and then how the material moves along the production line. But in this case, how people would move around. So certainly a lot of our senior students like to do some kind of facility layout project. So that's certainly something that we can do. And just like the simulation model that we're doing for Tracker Institute, it may be a little overkill just to do a simulation model for a restaurant, but that's definitely possible. That's definitely doable. So I will point out 2 possible techniques to do that. One is the facility layout. The other is the simulation model. Mm-hmm. And as far as the schools, we were not, we don't have an ongoing project. We were not contacted, but I would think it would be a very good project to consider. Schools have, how many different classrooms, and then all the entrance, and then just to simulate the whole school with again, we can manipulate different policies that the principals may have in place. How would those policies play out in terms of the interaction, the level of interactions that the kids would have with respect to the safety during the COVID-19? That's certainly that would be a really good project.
Mm-hmm. Well, maybe with the 6 weeks, at Jefferson County, I don't know about some of the other schools, but I know that Jefferson County has just put out a indication that it's going to be 6 weeks of non-traditional instruction where the students are going to be home and then they're going to figure out what they're going to do after that. So maybe we need to put a bug in their ear about your institute and what your institute can do.
Yeah, and also I am aware that, for example, University of Pittsburgh, my colleague at the University of Pittsburgh, who is also industrial engineering, so they are trying to help the school, the university, to safely reopen, especially with respect to the dorm, because I mean, dorm, that's where the students live, and then a lot of common areas that people would, go through, or, the elevator, the stair, all of those common areas. And then I know that my colleague there trying to come up with some kind of probabilistic model and say, what is the probability that people come in this area, or how through this particular contact point, say elevator and things like that. And then again, they're trying to also develop a simulation model, but their model was very focused just in the dorm area, in the dormitory.
Yeah.
That's certainly an excellent question.
Right. And as students are going to dorms and then taking all their classes online, there's a big movement towards that in the hybrid. One other question to add on to Barbara's is voting. What about, in November when we have, discussions about, absentee versus person voting, and has there been any discussion among your colleagues or at the national level about how there's been communication about voting and COVID?
Yeah, it's interesting. This is Barbara, you definitely should learn industrial engineering. You have a good grasp in industrial engineering. I think this is another excellent application. I was actually browsing through our organization's website yesterday. The organization called Institute for Operations Research and Management Science. That's basically where our professional belongs. There are a lot of talks about restaurants, about retail stores, about college football. It's kind of dominating there. So what's the effect if the college football, would still hold? So, I mean, someone was really worried about that. I have not seen anything about voting. That's certainly a great project. Thank you for that idea. And then, I can post to my colleague and see if anyone is interested in that. But certainly that's something of course we have to scope that, whether it's, I think if the dilemma is what would be a good mix for absentee ballot and for the in-person voting, so that if we're trying to address that question, then we build one model. If we're trying to address, for the in-person, voting place, how would you best guide people through? That would be a different project. But certainly that's something that industrial engineers can do. But there is no ongoing discussion, at least in that larger community, no such discussion yet.
Mm-hmm. We do have a question from Laura that says, have you been involved in the creation of COVID units, either in nursing facilities or in hospitals, to maximize patient care and efficiency while minimizing the risk of transmission to staff?
We are not at UofL, LoDI, Logistics and Distribution Institute or Industrial Engineering. I don't think we're involved in earlier design of the COVID-19. I don't think so. I'm not even aware whether there is any kind of a, retrospective study on whether those kind of design is efficient. I'm not aware of any of that work. But again, I think people do now get what industrial engineering can do. I'm so glad to be here, to be the messenger for our discipline, for our industrial engineering.
Yes. So are there any other questions or or comments that individuals would like to share? You know, one of the things, while those are coming in, I remember in our very first meeting, you talked about a hospital project that I think you and Monica were working on. It was like I believe a renovation or a redesign of a hospital. It was actually prior to COVID. I think it was one of the examples in which you were talking about, it was an emergency room department.
I believe you're referring to an animation of a simulation project.
Yes, yes.
Yeah. So that was kind of precisely that what we're following. We're after was the Trager Institute. So that was the animation of, you know, people coming in the emergency room and then going through triage area and then different rooms and then so forth. So that's exactly the patient flow simulation model.
Mm-hmm, mm-hmm, mm-hmm.
By the way, I mean, these are all very well documented in the operations research literature. So, you know, modeling patient flow, it goes back to maybe 2 decades ago. It's not something that's new. It's not something that's just occurring because of the COVID-19. I think it's just the general education about what, you know, simulation, what industrial engineering can do would be helpful. Yeah.
Mm-hmm. Mm-hmm. Yeah. So I think as people are thinking through, because I think we have a lot of individuals that are working in area agencies on aging. There's some other folks that I'm wondering what they're thinking as they're, you know, if somebody from Passport Health, wondering how they're thinking about how a logistics and distribution institute could actually help them as they begin to return to work, or consider how they're going to, you know, continue with their programming as it relates to how they're going to keep everyone safe. I wonder if those are, you know, trying to figure out how they can even articulate a question as it relates to, because this is, you know, I remember when we had our very first meeting and I had a, oh, I get it now kind of moment, you know, aha moment about, oh my goodness, how, you know, that industrial engineers really think through all these types of things, and how valuable you are to, you know, our work. And I just thought it was very interesting. And I know that I think some of us are probably still struggling as to how it, you know, it plays a role in their life. But I'm hoping that the work that you're able to do for our Traeger Institute, that we're able to blast it out to so many individuals and so many different outlets so that people can see the work. Can you tell us the history of the Institute? You know, how long has the Institute been around?
Yeah, I think the Institute started in 1998, if my memory serves me well. So it was created to, with the focus on education first, on logistics, and of course, research and then outreach. It's been around for over 20 years. So I think there are multiple directors before us, but since Dr. Gentili and myself, we took over in March. I think we kind of added a new thrust area, healthcare logistics, and that really take off. Right now, we're working with Traeger Institute. We contacted Rehabilitation Institute, Fraser Institute. We also have in contact with the ICU and then the OR operating room of UofL. So really national-wide, I mean, or internationally, this operations research and data analytics really become a very valuable tool for healthcare delivery. Mm-hmm. So this certainly is something that LoDI like to take on and then see some, blossom in the next few years.
Mm-hmm, mm-hmm, mm-hmm. Yeah. There's another question from Barbara. There's been much concern from employees and others about COVID issues in the work environments, like manufacturing plants and chicken and other meat factories. What type of work can be done to help these environments become more safe? It definitely seems like an area that you could lend your expertise.
Yeah, I think, I think in those cases, maybe the scheduling of the production or the staff scheduling, we just call workforce scheduling, may be something that needs to be, can be done. And other than that, because those production lines tend to be very more deterministic, I think, than your patient going out or your navigators, coming, they're more random movement. So I think those, as long as the safety guidelines are in place and people follow that, that would be good. Again, I'm not very familiar with those production manufacturing environments, so I may be naive, or I may not see a lot of the day-to-day operations in detailed level enough so that I can foresee a lot of potential concerns. But I think because the production line, everything is kind of more deterministic, so less randomness in there. So as long as there is a good social distancing, those type of guidelines, so that should solve most of the problem. However, I don't, at the workplace may be easy to enforce, but in a public, just public place, casual place, it's hard to enforce. So people's adherence to those guidelines, that will be another issue but I think in the workplace, that probably much easier to control than in some other more personal businesses space. Yeah.
Okay, let's see. I think what we're going to do is, if there are no more questions, we want to thank you so much.
I think I do have a third project.
Oh yes. Oh, go for it.
Definitely, Anna wants me to mention this. So this is not a real project like the previous two. The project was, one is ongoing, the other was finished. The third project was actually a proposal that Dr. Gentili was the lead on that proposal. And, Dr. Fall was part of that proposal.
Oh, yeah.
So the proposal was submitted to the Intelligence Advanced Research Research Project Activities. So the idea is to trying to address the problem where in the rural area, what's the most effective way to do the contact tracing. So contact tracing, in the beginning, it was all human operation, when somebody tests positive and then they get contacted by the public health officials and then asking in the past few days, where have you been? Who did you have contact with? And then they go from there, tier by tier, trying to trace back who might be exposed to risk. So, and then because of the human is always, first of all, they cannot be as real time as possible. Second, it's more labor intensive, therefore it's more costly. So there are a lot of technology that evolved, some technology based on cell phone, smartphone apps, and then some technology based on wearable devices. The idea for this project is for those, when you're in a rural area, your connectivity is a major issue. So this particular project that Dr. Gentili led, and then Dr. Pfau was part of it. So they have a kind of a two-fold solution. So on the technology side, what they do is they use balloons, tethered balloons, trying to, first of all, they would equip all the participants with some sort of an armband. It's a wearable device that will be able to tell where you are, and then will be able to measure your temperature, some other biometrics. I'm not super familiar with that, but at least the temperature can be collected. And then because of the rural area, so what they do is they would strategically locate some big balloons, tethered balloons, that will be able to receive the signal from those wearable devices. So in some sense, we're able to trace the individuals and then their temperature in real time. And those balloons, you know, they have their life cycle, and then they will be strategically located, first of all, and then they will be periodically replaced with newer ones that are more functional. So that's the first element, that's the technology element. And then the human element is, you know, for rural area, and especially this is for seniors, you know, if everything is based upon smartphone, however, the adoption rate for smartphone among seniors 65 or older, I believe the quote here maybe is around 40% or something. So it's low compared to the standard. In order for any contact tracing to work, you have to have adoption rate that I believe it have to be at least 60%. So our senior population doesn't have enough, doesn't have high enough adoption rate, you know, for those smartphone app-based, you know, technology. So how do we, you know, attack that problem? So the second part of the solution, which Traveling Institute would help, is they would send out, you know, the community leaders and then work with the seniors. So this is sort of a social work type of project, so that they can run the focus group, and then making sure that the seniors are educated, and then they will be being transparent about what the technology will do and it will not do, and then say the technology will protect their privacy and all those kind of things, and then making sure they feel comfortable when such a technology with balloons or wearable devices are in place, they're invented, they feel comfortable using that. I think the human element, particular to that project, is very, very important. I think that will actually address some of the national issues, because people, you know, especially with seniors, technologies are just, you know, changing so rapidly, they just cannot absorb all of those information, let alone a lot of concerns about the privacy. So with the social work, be able to deploy, you know, your people around those communities, and then run some focus group, really assure them what will be done, what will not be done, I think would be helpful to increase that adoption rate to the point where this contact tracing will be effective. Otherwise, if your adoption rate is low, no matter how great technology is, it will not meet the end at, you know, ultimately.
Yeah, that's an interesting project too. Yeah, I was on vacation when you guys were working on that. Is there anyone that has questions about that particular project? Any questions about that one? Well, we'll see how that that proposal was submitted, and or is it?
Yeah, it was submitted on July the 7th.
Okay.
We'll see.
All right, that's right. Fingers crossed to see that one goes. Yeah, that's an interesting project as it relates to older adults and contact tracing and the rural areas. Very interesting. Okay, all right. Well, thank you so much, Dr. Bai, for sharing all of those projects that you're working on. I do want to say that we are going to make sure that we tape this. We're going to put it on our website so individuals can seek you out and can listen to this again. It'll be on our website in about a week. Is that right, John? Yeah, okay, in about a week. All right, so then people can continue to think about it and reach out to you and go on and look at your institute. So thank you. Before we close today, we are going to do another survey. We're going to be doing the survey for just a couple of times, maybe several times, to get a sense of a rolling average of a variety of things that are on the survey. So we're going to have Sam Cotton go on and see if she can deploy the survey. And we ask that all individuals that are able to go on and complete this very brief survey. It helps us understand who's with us and a few other things that it helps us with our grants and being able to continue to put these on. So let's see. Wow, there we go. We start to have some individuals complete it. All right. So as folks are going to continue doing that, wondering if anybody has any questions for Dr. Morton, Laura Morton, anything regarding any of the things that she had addressed at the beginning of the conversation. We just have a few more minutes left as people are completing the survey, and wanted to see if there was anything else that anybody thought of that wanted to ask a question to Dr. Morton. So Dr. Morton, you said at 4 o'clock every day, Governor Beshear is on.
Governor Beshear back at 4 p.m. every day, and wear a mask, hand hygiene, socially distance. That's the big take home message here. So we can hopefully get back on track with our numbers.
That's right. That's right. Okay. All righty. So with that, I think what we're going to do is we're going to go on and end this session. Thank you so much for everyone coming and engaging with this material. And we appreciate our guest speaker and Laura. Thank you so much, everyone. We'll see you next time.
Thank you for the opportunity, Pam.
Sure.
Have a great day, everyone. Yeah,
And
feel free to send your questions to me if you have any.
yes, please do.
All right. Bye.
Bye-bye. We'll see you next day, everyone.
Bye-bye.
Bye-bye.